Sciatica, leg pain, burning pain from your back all the way down your leg. That's sciatica. No fun, debilitating, and really impacts the quality of your life. What are the simple things you need to know to help fix sciatica and the exercises that work the best? Well, they fall into two camps: Williams protocols and McKenzie protocols. Sometimes you can do both, sometimes you can only do one. The question is, which one? Let's look at Williams protocols first. Those are called flexion exercises. Grab this knee, pull to your chest, stretching the hamstring and opening the hip. Williams protocols, one knee at a time, both knees at a time. Okay? The key with these is you're flexing, you're bringing the knees towards the chest. Opens up the disc spaces, and by opening up the disc spaces, it takes the pressure off the nerve. So it opens it up this way, allowing more room for the nerve. We also want to add the Piriformis Stretch to this. Cross this leg over, Amanda. No, let's do, there you go. And we get way in through the butt, and it opens up the piriformis muscle, which runs across the hip, and the sciatic nerve goes right underneath it, a common cause of sciatica. So Williams exercises open you up in what's called flexion to make more room for the disc and the nerve. However, McKenzie also works. Flip over onto your stomach. McKenzie is the reverse. It's extension, where now Amanda's this way, and she's going this way, opening up the disc from the front, allowing that herniation that hits the disc and the nerve to suck forward. So press up. Just start with a little bit of a press up. If you're having right-legged sciatic pain, bring your feet off to the left, opening up the disc spacing and then extending it, and then arch up. First, just arch up, prop up on your elbows first, like you're reading the paper. Start there. If that's comfortable, then come up into a cobra. Then you come up into there. If that's comfortable, then you can do it with your legs straight. McKenzie protocols. Once you stretch, then you can strengthen. But first we have to lengthen both the hamstrings when it's the Williams protocol, or the lower back and the hip flexors in the front if it's McKenzie protocol. Let's go face up. So you need to understand one versus the other. Find out what's more comfortable. That's the easiest way for you to alleviate your sciatica. If the knee to chest exercises are better, continue with those. If extension is better, well then do those. With extension, it helps to put your feet away from the side of the leg pain, to shift away. With sciatica, oftentimes the disc is involved. What else you need to do? Lots of walking up to but not through the point of pain. Avoid sitting. Sitting will have an aggravating factor on it. And if you are sitting, maintain normal alignment, good posture in the lumbar spine. Watch the video on exercises for people who sit that talks about how you can keep the alignment in your lower back sitting. Sciatica, no fun. However, you need to get the pressure off the nerve and open up that disc spacing from the front or from the back. McKenzie or Williams, you still need to open up the spacing, suck the disc away from the nerve, alleviating the pressure. Once the pain reduces, then you go to core stability. Don't start the core stability until the inflammation and pain have subsided. I'm Dr. DeFabio, and that's the DeFabio difference in addressing sciatica in our office.